Change my background here.
You know what it looks like on her end, because we can't see.
What are you looking for?
Just looking at what
Oh.
you can see.
Oh, it's not showing up there.
Yeah. Hi, Rebecca.
I don't think she can hear you
Oh.
because we're on mute.
Ah,
Okay, you ready?
sure.
What do you see?
What's that?
What do you see?
What do I see?
Yeah.
I have my presentation.
Oh, that's weird.
So
All
that's
right.
how I have to do it.
I'm going to see if I can figure out how to give you control of that.
It's totally
You guys
fine.
supposed to be on mute?
Mm-hmm.
Because I can hear you guys talking.
Good, Rebecca. All right, let's get started. I think it's because we're joined in there.
Nice. Right here works. All right. Are we ready to get started?
Ready to roll.
All right. So, hello, everyone. My name is LaDawn Yazzie, Tribal Public Health Educator. I can really hear an echo. So anyways, my name is LaDawn, and I'm here in a partnership with the CDC. Sorry, I can just hear the echo. I'm here in a partnership with the CDC Foundation and the Albuquerque Area Southwest Tribal Epidemiology Center. We have partnered to help in response to the pandemic and to assist with the needs of the health and human services of the San Ildefonso community. So this allows us to provide support to help alleviate the stress of the pandemic. And so today, one of the topics that I'm going to talk about that I would like to encourage individuals in the community to consider is increasing physical activity and the benefits of physical activity for your body. So, okay, next slide. And so basically what we're going to talk about, or one of the things that we have challenges understanding in Native communities is the diabetes epidemic. We're not understanding that high blood pressure, maintaining high blood pressure is an important aspect of health. And so as Native people, we have taken on many changes in the world. We have encountered many difficulties. And so as a result of the changes that have taken place over the past few years, we have encompassed health diseases, one of them being diabetes. Diabetes in Native communities runs rampant, not just here in New Mexico, but all over the United States and Canada. And so one of the statistics that stands out to me was one I came across about obesity in adults. Or obesity basically is an individual who's overweight for their size. And so what happened was obese adults were 3 to 7 times more likely to develop diabetes when they were compared to normal weight individuals. And this is one of the astounding statistics we should take into consideration. It's not 2 times more likely, it can be up to 7 times more likely. And so that's one of the takeaways I would like to share with you. So here at the Health and Human Services at San Ildefonso, we are looking at different ways of encouraging and improving health outcomes. And solutions have been discussed, not just here in San Ildefonso, but all over. We're looking at solutions that include healthier eating habits, healthier food options, healthier snack options. And so when we think of healthier options, as far as looking at the different foods that we include in our diet, it could range from changing out a slice of white bread for whole wheat, whole grain items. Maybe for your snacks, it could be increasing higher fiber, more fruits and vegetables, adding color to your plate. So that's one of the ways you could look at, analyzing what you're eating instead of opting for the processed foods that are readily available. So those are things we could consider and think about. Today's topics, we're going to talk a lot about increasing physical activity, and then we're going to touch on weight loss and weight maintenance. And so there are actual benefits and studies that have identified how individuals can the benefits of decreasing weight for an overweight, obese individual has resulted in the changes to insulin sensitivity. So basically, this allows the body's cell to use blood glucose more effectively to lower blood sugar levels and prevent or delay the development of type 2 diabetes. So basically, you're taking control of your health. And other long-term benefits could reduce a person's chance of getting heart attack by decreasing their blood pressure. Additional benefits of increasing physical activity, we understand it'll reduce high blood pressure. It can reduce the risk of stroke and several forms of cancer. It also can reduce arthritis pain. It can reduce the risk for osteoporosis and falls, and it can reduce the symptoms of depression and anxiety. So it really is increasing some of those hormones, those natural, the natural energy in your body to help combat some of these elements in the body. And so here I was looking for information. The most recent information I found was a study conducted by Harvard Medical School. In California, in a healthcare facility, 48,000 adults who had confirmed COVID-19 between January and October 20th were divided into 3 categories listed here. These individuals were divided into those who were consistently active over 150 minutes per week, Another group was divided into those who were consistently inactive with 0 to 10 minutes of activity per week. And the third category were those who were active in a range of 10 to 149 minutes per week. And so astoundingly, we found, or it was found, that those who were consistently inactive had a much higher risk of hospitalization, ICU admission, and death after getting COVID-19. So in tandem with the last study, I was trying to figure out how we could understand the benefits of exercise, and I found this information very helpful. And so basically, what was found with individuals who were sick with COVID, a syndrome was identified, and it is called post-COVID-19 syndrome. And the elements of this syndrome are fatigue, difficulty breathing, headache, stress, depression, irritability, insomnia, confusion, or frustration. And so one of the examples that I wanted to show, because this graphic here provides us with a lot of information, and I want it to be able to be digestible and understandable so that our listeners would understand. So what I took away was that there are potential benefits from exercise. Evidence exists to show how exercise is beneficial in many pathologies of the disease where post-COVID syndrome shares similar symptoms. So if you look closely, you can see how exercise can decrease your stress level. And post-COVID syndrome, an individual has been shown to suffer from post-traumatic stress. And then I have Troy here, who's also going to share a little bit of his knowledge regarding the benefits of exercise in regard to COVID.
Thanks, LaDawn. Make sure the echo.
Sorry. Can you hear me now? Okay. So I was talking and the mic was muted, so I apologize. So one of the things that I wanted to talk about is, the overall benefits of exercise and just basically reducing the risks of chronic illness in general. Because we all know that the reason why a large majority of individuals have really poor outcomes from COVID-19 is that they have these pre-existing or what they refer to as underlying conditions, whether it's diabetes or uh, high blood pressure or any other chronic illness that puts you at greater risk of poor outcomes from COVID-19. We have to look at the benefits of exercise and reducing all of those chronic health conditions. So um, I was just basically wanting to point out that it's not just uh, COVID-19 in general that we're trying to prevent using exercise, but um, preventing the illnesses and the chronic health conditions that may lead to poor outcomes from COVID-19 is what we need to start looking at. Instead of just addressing COVID-19, we're looking at long-term benefits over your lifetime instead of just during this pandemic. And what has also been known is that exercise boosts your immune system. So if you think about you know, one of the reasons why people are having another reason why people are having poor outcomes from COVID-19 is that their immune systems are not responding appropriately to the virus or any other illness for that matter. And so exercise, just exercise and healthy eating and maintaining a healthy weight are extremely important in trying to, ward off any kind of how do I say, um, poor response from your immune system. So you want a better response from your immune system. So exercise is one of the ways to boost that. Increasing your healthy nutrition, increasing your exercise, all those different things um, make things make it better for you with regard to COVID-19. So that's all I wanted to add.
Okay, and so on to the next slide. So questions we could consider um, that I can share a little bit of information on, and those questions could be something like, how much physical activity do I need? Or what levels of exercise or intensity would be helpful? So we'll talk a little bit about that. For the first question, the physical activity necessary according to the World Health Organization. If you're looking to maintain your weight, it is recommended that 30 to 45 minutes of moderate activity is helpful. So that's going to be walking 30 to 45 minutes per day. If you want to reduce the risk of heart disease, and that's what we all want to do, is to reduce our chances, is to increase that time, basically double that time. So at least 60 to 70 minutes of moderate intense activity is helpful, as well as 35 minutes of vigorous activity. So basically jogging. And then if we're looking to lose weight and keep it off, this would require both regular physical activity and a healthy eating plan, as Troy mentioned. So, and then we're going to talk a little about individual, like we're going to talk about what moderate intensity means. So when we say moderate intensity, it could be when you notice your breathing and your heart rate is faster, but you can still carry a conversation during this time. This is walking briskly, 15-minute a mile walk, light yard work, which could include raking, bagging leaves, or using a lawnmower, light snow shoveling, and then also actively playing with children to biking at a casual pace. And so moderate levels of activity, one area I want you to focus on in this chart is looking at walking. So the calories used, for example, an individual that is 154 pounds can use 140 calories by walking for 30 minutes, or they can use 280 calories walking for one hour. Next, what does vigorous intensity mean? This is actually really increasing your heart rate. So it's at a higher level where you're breathing hard and fast, and you would have difficulty having a conversation during this time. So that's going to be jogging, running, swimming, or playing competitive sports like football, basketball, soccer, and even jumping rope is also considered vigorous intensity. Next, we're going to look at vigorous levels of activity. So here we're going to use the same example. A 154-pound individual can use 220 calories in 30 minutes and by doing heavy yard work. So that would be like chopping woods, or they can use 440 calories doing heavy yard work for an hour. So basically some of this, our activity levels we're already doing and we don't realize it. And then sometimes we just kind of forget and we don't realize some of our daily activities are already a big part of what we're doing. So maybe adding a little bit more time to what we're already doing, or even considering just a new workout regimen to include if we're looking to either lose weight or to maintain that weight, or if we want to look at reducing our heart disease. So now I would like to share and post a question to the audience. If you would like to share, please let us know what daily physical activities are you already doing, or do you have tips on getting started? What got you started? And then also, what is your motivation? Is there something you would like to share with the community that has worked for you, or that will help you to move forward in increasing your physical activity? And then next, if we're questioning, like if we're curious, next slide. So if we're curious and we'd like to know and have ideas of what's taking place in Indian country, there is a webinar that's provided by Native Wellness Institute, and it will start tomorrow, January 20th, and it will take place again January 21st, starting at 10 a.m. And so this basically is a 2-day training that will provide tools and strategies for you to plan a new year that you desire. It will provide exercise to help let go of that baggage that may be weighing you down. It'll provide you with some guidance on what you can do to get motivated. It'll help to inspire you to embrace the best you. And so that's what we're looking for. We're looking for current information that will allow us to get started, kind of get us motivated and moving in the right direction. It's the beginning of the year. We could look in different areas if you need help, if you need ideas, or here at the Health and Human Services, we're available to work with individuals who may need a little bit of help getting started. One of the a few initiatives that are taking place in the world I want to talk about is one of the initiatives that took place last year during Healthy Weight Week. This week is Healthy Weight Week, and there were 3 women that were identified taking on this initiative to increase health around the United States among Native people. Those individuals are Akashia Red Elk, a yoga instructor from Pendleton, Oregon, provides online tutoring for those who are looking to meditate or find different ways to incorporate exercise into their daily life. And then also Michelle Reed, a Woodland Sky Native American individual who is also providing hoop dance instruction online. And then lastly, Luvina Louie, who also works with Native Wellness Institute. She started an online initiative called Powwow Sweat, and she provides this online tutorial if you're interested in intertribal style of dancing. Those are a few things that are taking place. But yeah, that's really all I have to share, but you're welcome to share and provide information or ask us questions. Okay, we also have our CDC public health nurse who would like to add to the discussion. So, hi, Rebecca.
Hey, LaDawn. So I really like a lot of the things that you pointed out today. Something that I'd love to add to activities and exercise is it's really important if it's not something that you regularly do, folks may want to consider not overwhelming themselves with excessive amounts of activity at first. You always want to start with you just want to start small, start baby steps. Maybe your first walk is 10 or 15 minutes, and you just build every time you go, you build another 5 minutes on. You want to sort of, make an activity that you enjoy, and don't make it so that it's something you don't want to go back to. If you just start working out like crazy for an hour, you might feel the next day a little bit sore. You may not want to do it again. So it's important to remember to do things, step by step, or do things in a way that make you want to go back and do it again. So if you go for walks, maybe you find a place that you really like to walk around, whether it be the woods or just through the neighborhood, places that you enjoy, maybe visiting the river, and halfway through your walk, you could take a moment to have some mindfulness where you just stop and notice things around you. Make it a really enjoyable thing to do. One of the other things I think that you were pointing out with activity, and especially diabetes and hypertension, is that mostly focusing on diabetes type 2, is that walking for at least 45 minutes a day can help regulate your overall blood glucose levels. So if you're struggling trying to, it's not going to cure things, but if you're struggling trying to control your blood sugar levels, this walking for 45 minutes can really help bring that down, regulate things. It's not going to be a huge jump, but it's an enormous help in the end in trying to get things rolling in the right direction.
Thanks, Rebecca. I wanted to add a couple of things too, just to kind of elaborate, strength training is one of those things that we really undervalue when we're talking about prevention, and especially type 2 diabetes. The reason why the strength training is really important is because, the blood glucose that circulates in your bloodstream it's happy places in your muscles. So, that's one of the things I've always said. I've been, a personal trainer for more than 20 years. And one of the things that I've tried to emphasize with people who are coming in with type 2 diabetes diagnosis is that type 2 diabetes does not have to be permanent. It actually can be reversed if you change your diet a certain way and you increase your physical activity. And so building muscle content and muscle mass will help facilitate taking that blood glucose out of your bloodstream and actually putting it into your muscles and having your muscles use it the way it's supposed to for energy. And so if you think about what Rebecca was talking about the increasing that activity, and we don't want to discount strength training. We don't always want to focus on aerobic activity and walking and things like that. Body weight activities like squats and you have two gallons of milk at home or water at home, and you pick them up off the ground as a quote unquote deadlift. You're building certain muscles in your body that allow your body to use the blood glucose in your system a little bit more efficiently. So I wanted to point out on that, but I also wanted to talk about, I wanted to go back to a slide you were talking about, Rebecca, on the activity levels. And the diabetes program actually gave out some smartwatches earlier in the year or last year to help people monitor their physical activity. And I think that they monitor heart rate. And I just wanted to, if you have like a smartwatch, or it's an Apple Watch or a Fitbit or some sort of uh, watch or device that kind of um, helps you to monitor your heart rate. A good way to determine, because trying to use some of these definitions to kind of define what moderate intensity or vigorous intensity activity is sometimes hard to figure out. Whether you're breathing hard or you're sweating or whatever. Sometimes those things aren't necessarily the best way to evaluate that, because some people sweat earlier than others. Some people have some certain medical conditions where they will start breathing more, breathing harder just based on basic physical activity. So a good way to monitor it is to take that Fitbit, to take that Apple Watch, and have it monitor your heart rate, because determining the percentage of your max heart rate is a good way to help everyone, kind of really understand what the intensity is. And moderate, that 50 to 70% of your max heart rate is actually a good way to manage or monitor that moderate to going into vigorous activity. So those items that you are wearing every single day to answer your phone and to talk to your friends actually can be beneficial for your heart health and for your weight loss and for managing your chronic health conditions. So if you need help, I know Raylene was giving some instructions on how to use the smartwatches that we gave out. If you need a refresher or you didn't get your smartwatch, hint, hint, contact Raylene over at the diabetes program, and she can get you set up. So those are all the people that are part of the target population for the diabetes program. Go ahead and show up, contact Raylene, get your smartwatches set up so you can really monitor that activity a little bit better than just kind of guessing. So I just wanted to add that. Any questions on that? Anyone?
So there weren't any questions in the comments.
Hey, LaDawn. I can see your mouth moving. I can't hear you though.
There you go.
Sorry, I don't know how much anybody heard.
Oh man.
Oh, goodness. All right, that's okay. I'll start all over. So I was just going off about how we, in a small community, I come from a small community on the Navajo Reservation, and I found it challenging to work out, to exercise, to find a trail, to find a safe place to exercise, because sometimes there's dogs that are tied up or something, something along those lines. There's no street lights. And so we run into those challenges, and it's not the end of the world. We can find different ways to exercise, to move our body. So sometimes we take calling exercise, we take it in a way our mind thinks about it as stress, as Rebecca mentioned. We don't want to take this physical activity and allow it to kind of to be a negative aspect of what we're doing. We want to find something that is enjoyable. We probably already are doing something that's enjoyable. We just don't realize it. So that's something I want to share. And then also, a lot of people are struggling with how to work out during this time, during the pandemic. And usually I found myself walking, doing a lot more walking than usual. You know, I was stressed. I was still in school. I was finishing up school. So before exams, everything moved online. And so it was really difficult for me to kind of find an outlet. And so walking did help me with a lot of that anxiety and challenge with daily physical activity. So
Yeah, I just wanted to add a comment.
About a comment that was posted in the chat about our trails. So the Pueblo does have the walking trails that we do. I mean, many. I don't know if many people are utilizing them or making it a priority to get out and use those trails for outdoor exercise. But it is important to understand that they do exist. Um, the like LaDawn was saying, you know, there sometimes people think that you need a gym or you need some sort of facility or location to actually get involved in physical activity. But we have all this outdoor. We have everything outside that we can utilize. And, you know, if you all out there are struggling to find options or struggling to come up with ideas because you know it's been 2 years since we've been in the middle of this pandemic and we've kind of lost track of what we've used to do. Contact us. We can help you figure out some ideas about how to re-engage and restart some sort of a physical activity program for you and your family, to get people more involved because you know one of the things that has suffered with the pandemic is, you know, people's waistlines. You know, people have done a lot of boredom eating. They've done a lot of you know, um sitting around and not really being active, and of course that creates a little bit of you know, you get stagnant and you lose the motivation to get out and do things that you want to do. So one of those big um, things that you want to do is find a way to get started again, to get back to doing what you used to do. If you weren't doing anything before, how do you start doing something new? Because that activity is one of those things that's going to keep us healthy. It is going to be one of those things that keeps our bodies in, you know, what in the medical field they refer to as homeostasis, in balance. You know, you don't want to be in a position where things are out of whack, so to speak. So we have the trails, we have other areas, the softball fields. We can actually come up with some, you know, outdoor activities that we can do as a group potentially to get back to doing exercise. So I just wanted to throw it out there because Thomas Gonzalez did put that in the chat about the trails, and you know we'll be doing more to promote those things in the future. But outdoor activities, that's an important thing because that's what we have available here in the Pueblo.
Yes, and it's beautiful there. It's so nice to be out. Sorry. Sorry about that.
So it doesn't seem like we're getting too much feedback. Does anyone want to share what physical activity they've been sharing or they've been you know, they've taken on over the past year? Please let us know. We'd like to know, and we'd also like to share information with you. So.
So Jeannie, yeah, the walks. I think one of the challenges we had with the walks was, you know, uh, there were a couple of people that were participating at the beginning, but then that participation kind of went down. And then the weather was changed up, and then of course we had these issues with all these new cases. But yeah, absolutely, we can start the walks up here soon. We we're hoping that the cases would not be so extreme that it took up all of our time. We'll definitely want to talk about getting those started again. And if anybody is curious about the walks, we did have them scheduled every Tuesday and Thursday. The diabetes program was hosting one on Tuesday, and the CHR program was hosting the Thursday walk. And I think we had them originally scheduled for 8:30, but it got too cold, so I think we're down to 10 o'clock in the morning where it's a little bit warmer. So we'll get together and start talking about getting those walks started again, because those are definitely beneficial.
Raven, Raven and I had a conversation earlier today. We were talking about how maybe we could get something started even within our departments. I feel like we could maybe look at how many steps each of us or each department is getting in. I feel like that might jumpstart individuals. It doesn't have to be, maybe it wouldn't have to be, too strenuous. It would just be like everyone kind of participating and just adding up how many steps they're getting in the department, so we could have kind of like a little challenge, yeah, to see how we're doing throughout the week. And that's one idea for Summer Delfonso. If you're interested, I think that would be very, very good in the long run. Just getting started, it wouldn't have to be anything.
It doesn't just have to be the departments within the tribal administration. I mean, if there are members of the community that want to come up with walking challenges or exercise challenges or bike challenges, you have ideas that you want to do that you would be willing to participate in, come to us, talk to us. We'll get something set up and arranged, and we'll figure out a way to incentivize your participation if we have to. Because I know, getting out and doing activity after being out of it so long can be difficult to start. And if we need to help you guys do that, we're available for that. All right. Do you have any other questions from the community? Any members of HHS that may be logged in that may have some ideas or to add to the conversation? And Thomas, I actually did do that already. I'm in the process. That's one of the contracts that I was referring to from earlier. I'm working on getting that. Um, it won't be as big as it was before. We're still talking about trying to figure that part out, but we have been working on contracts with the three gyms that are in driving distance for the Pueblo, for Poake Wellness Center, for Anytime Fitness in Espanola, Anytime Fitness in Los Alamos. So I had one signed contract. Once those other two contracts are signed, we are going to be starting a pilot program for gym memberships for community members that are interested in joining the fitness program. And of course there's going to be requirements and stipulations and things that you have to do to be part of the program, but it is going to be something that is coming up soon, hopefully. So I've been working on it since I think March of last year, and I just got one contract signed in December and waiting for the other two. So fingers crossed. Sean, that definitely is something that's in discussion. And the question that he had was, is there a plan for any sort of wellness facility of our own? We have been discussing that recently, but there's nothing finalized. And if it does happen, it's going to be sometime in the future, not anytime in the near future. So we're working on it though. Any other questions out there?
I just want to encourage the New Year, New You. If you have time tomorrow or Friday, check it out. It starts tomorrow at 10 a.m. and we're sharing the Zoom meeting ID and passcode. There's also an availability if you want to join through your mobile phone. I think it's going to be, they're going to have very interesting topics. So it's free. Check it out if you have time. Thank you.
We posted it in the comments.
So as we're sitting here, we're looking at the comments. And
Yeah. So we're not just being silent.
Right. We're not just being silent on purpose. There are comments that are coming up in the chats, and we're trying to address them as they come up. Mr. Gonzalez put in the comments indicating that the gym is going to be renovated soon, and there's a possibility that might include gym equipment to be here on the Pueblo. So that is something, like I said, we have been discussing, trying to figure out how best to serve the community best. But that is something that is coming soon. And Lillian, I will actually put that in an email, send that out for the sessions for tomorrow and the next day. Yeah, 2 stories would be great. An indoor running track, a swimming pool, all of that would be great. But can we afford that? I don't know. Right now, that's, I was actually on a committee last year. Rio Arriba County is talking about building a new fitness facility for Rio Arriba County residents, and they were looking at a swimming pool, and I think it was like $6 million just to start up, just to get the pool started. And to me, that's a little bit more than anybody I think would want to spend up front. So pools are kind of difficult these days to add to a fitness facility. LaDawn, what was the name of the
presentation.
The New Year, New You? Is that what it's called?
yes.
Okay, I'm putting that all in the email. Wish we had an opportunity to send that in the bulletin, but that's not going out until the beginning of the month. I am sending it out to San IP.
Yeah. Good.
All right, so we're coming down to the end of the wire. We're scheduled from 1 to 2, giving people an opportunity to ask questions if they have them. Some good questions have come in the comments. I appreciate those who have participated. This is your show.
All right. Well, I appreciate your time. Taking this little time to spend here with us in Sinai. I'm very happy to be here with my colleagues here. We're going to do the best that we can to provide you with current up-to-date information to encourage you to be healthy, to take care of yourself. In our native language, the Navajo people, we talk about walking in beauty. And I want to encourage that message that requires a lot of perseverance, resilience. Native people all over the world have had difficulty most of their lives, but individually, we've got to take a look at ourselves. We've got to love ourselves. We've got to appreciate those around us. So I just want to leave you with that message, and thank you for being patient. We're doing the best that we can with sound and all the technology, and we're thankful for everything everyone does here to make this possible. Yeah.
It's been an honor to be able to help provide some of these services for the community, and the fact that we have two dedicated um, public health professionals that are willing to join our team and provide us with uh, the, um, their expertise and their knowledge to help to build capacity within the community, not just staff wise and resource wise, but just basically trying to build programs to help make the future of the Pueblo a lot brighter coming out of the pandemic, because that has been such a challenge for not just us in the Pueblo, but for the basically the entire world and country. So we do want to make sure that we do whatever we can as a department and as a team to help you all to rebuild after COVID, because that's the hardest part. About now, can you hear me now? There was a comment in the comment. There's a comment in the comment section that said my mic wasn't working, but is it working now? I have no idea what was going on there. Okay, so what was I saying? I was just trying to say that one of the honors and privileges that I feel like that I've been able to experience working for Sanai is to basically to help build capacity and bring services and resources to the community that's definitely needed to help to get out of this pandemic, because the pandemic um, has affected just about everything and everything that we do and everything that we would like to do. And I think HHS is in a pretty good position to try to help bring certain things to help us to navigate our community out of this crazy is what I call it. And being able to have two talented and educated and experienced staff members to join our team, Rebecca and LaDawn, I don't think that we could be any luckier than to have those two join our team, because you guys are able to hear them talk about what they're talking about on these presentations, but what they're doing behind the scenes is a lot more than what you guys know. The fact that they're building capacity within our community education, topics about COVID and just trying to build programs and processes to help us as a community grow and recover. I just can't thank them more for um, wanting to join our team and wanting to stay with our team, because their grants were supposed to end in July of 2022, but I think the last bit of information that we had is that they may be around for a little bit longer than that. So I'm hoping, crossing fingers, and because they want to stay with us and they're not trying to run away. That's always a good thing. So thank you, LaDawn, and thank you, Rebecca. I appreciate you. I think the community appreciates you, and I'll give you guys an opportunity to give your last comments.
Well, thanks, Troy. I think it goes without saying that we all really appreciate you. So far, it's been a fantastic experience for me. And I'm really grateful that I got to go to San Ildefonso for work several times a week. And this has just been a really good experience for me. I know I can speak for myself, but I'm very excited for the future, and I hope to have a lot of things to offer everyone to help create a healthier folks and happier folks.
Was it a hug?
Yeah. Thank you for joining us. Thank you for spending a little bit of your time, maybe wrapping up. I'm really happy to be here. I'm really thankful that the community has been very gracious to allow us to come in to share our expertise, but also you're allowing me to learn. You're allowing me to learn about your culture, about who you are as a people. I really appreciate that because I haven't been outside my reservation. The culture is definitely different here. It's I'm very appreciative, and I'm seeing that we have a lot of similarities, my community and the San Ildefonso community. I see quite a few things that are going to allow me to learn from you. And then also I'm doing my best to give back and to provide information, things that I've learned in the culture that I've been raised in. So yeah. Thank you and have a great day.